I often feel like when I've come from a treatment from you that I can feel the movement right away. So what can people expect to get from this, and how should they treat the treatments? Is it a one-time thing? Should you forget your doctor? You know?
Definitely, I wouldn't say a one-time thing. A lot of people come to me and say, oh, I've tried acupuncture, and I ask, okay, well, how many times did you go? Well, I went once. Oh, okay. I wouldn't say that you've tried acupuncture. General rule of thumb is 5 to 10 treatments. So as you might have realized, you might have had some relief that evening, maybe a few hours, and then maybe the next day it started to come back a little bit again because you are holding your camera again, you're doing those things that's creating that stagnation. So each time that you come in, it becomes accumulative. So after 2 treatments, it might last 2 days. After 3 treatments, it might last a week. So you do have to give it that time in order to heal. And you have to make some changes on the outside as to what you're doing to make that an issue in the first place.
Right. So you talk about not just that treatment, but you have to make some other changes. And you use teas as well. What other services do you provide? So there are other changes and other things, not just acupuncture, right?
Right. Yeah, absolutely. So pretty much anything that you'd go to your physician for, and I'm not talking emergency situations, and I can't order an MRI or blood tests, but general ailments and injuries and things like that you could come to me for. I just treat it differently. So like I said, herbal therapy, massage, herbs, the herbs I love, Chinese herbs. It's a little bit different than you going to a drugstore or going to a health food store and purchasing herbs because we actually make them up. Like you have shoulder pain. So if 4 other people came in to me with shoulder pain, it may be for different reasons. So I'm going to treat you differently. So I actually combine the herbs for you specifically and give you that formula. And as your body changes, I modify that as well. So it's not something like, here, take this magic pill and take it forever.
Right.
It's, this is specifically good for you right now.
Who else would this be good for? I mean, for me, it's my shoulder. Who else do you typically see here?
I treat all kinds of patients, you know, infertility, miscarriage, a lot of women's issues, PMS, insomnia, digestive issues, you name it.